A comprehensive guide to cat diseases. Cats, beloved companions to millions around the world, are known for their independent nature, playful behavior, and unique personalities. However, like all animals, they are susceptible to a variety of diseases that can affect their health and well-being. Understanding these diseases, their symptoms, prevention, and treatment is crucial for cat owners to ensure their feline friends lead long and healthy lives. This comprehensive guide will delve into some of the most common cat diseases, covering infectious diseases, chronic conditions, genetic disorders, and more. Infectious diseases. Infectious diseases are caused by pathogens such as viruses, bacteria, fungi, and parasites. These diseases can spread through direct contact, contaminated environments, or vectors like fleas and ticks. Some of the most significant infectious diseases in cats include feline leukemia virus, FeLV. Feline leukemia virus, FeLV, is a retrovirus that affects cats worldwide. It is transmitted through saliva, nasal secretions, urine, feces, and milk of infected cats. The virus can cause a variety of health issues, including immunosuppression, anemia, and lymphoma. Symptoms: weight loss, fever, lethargy, swollen lymph nodes, pale gums, recurrent infections, and diarrhea. Prevention: vaccination is available and recommended for at-risk cats. Keeping cats indoors and away from infected cats can reduce the risk of transmission. Treatment: there is no cure for FeLV, but supportive care and treatment of secondary infections can improve the quality of life for infected cats. Antiviral medications and immune system boosters may also be used. Feline immunodeficiency virus, FIV. Feline immunodeficiency virus, FIV, is another retrovirus that affects cats. Similar to HIV in humans, it is primarily transmitted through bite wounds from infected cats. Symptoms: enlarged lymph nodes, fever, weight loss, chronic infections, gingivitis, and neurologic disorders. Prevention: no vaccine is available for FIV. Preventing fights and bites by keeping cats indoors or away from known carriers is the best preventive measure. Treatment: there is no cure for FIV. Management focuses on maintaining a healthy lifestyle, preventing secondary infections, and treating symptoms as they arise. Feline infectious peritonitis, FIP. Feline infectious peritonitis, FIP, is caused by a mutation of the feline coronavirus. It is a highly fatal disease that can manifest in a wet, effusive, or dry, non-effusive form. Symptoms: wet FIP is characterized by fluid accumulation in the abdomen or chest, leading to swelling and breathing difficulties. Dry FIP presents with weight loss, fever, jaundice, and organ dysfunction. Prevention: there is no effective vaccine for FIP. Reducing stress, maintaining good hygiene, and preventing overcrowding can help lower the risk of infection. Treatment: FIP is usually fatal, but antiviral drugs like GS441524 have shown promise in recent studies. Supportive care and symptomatic treatment are essential for managing the disease. Upper respiratory infections, URIs. Upper respiratory infections are common in cats and are often caused by viruses such as feline herpes virus, FHV, and feline calicivirus, FCV. Bacterial infections can also contribute to URIs. Symptoms: sneezing, nasal discharge, conjunctivitis, coughing, fever, and loss of appetite. Prevention: vaccination against FHV and FCV is part of the core feline vaccination protocol. Good hygiene, reducing stress, and avoiding overcrowded environments can help prevent URIs. Treatment includes supportive care, such as maintaining hydration and nutrition, as well as antiviral or antibiotic medications to address specific pathogens. Chronic conditions. Chronic conditions are long-term diseases that require ongoing management to maintain a cat's quality of life. These conditions are often more common in older cats but can affect cats of any age. Chronic kidney disease, CKD. Chronic kidney disease is a progressive condition that impairs kidney function over time. It is one of the most common conditions affecting older cats. Symptoms: increased thirst and urination, weight loss, poor coat condition, lethargy, and vomiting. Prevention: while there is no definitive way to prevent CKD, early detection through regular veterinary checkups can help manage the condition more effectively. Treatment focuses on dietary modifications, hydration, medications to manage symptoms, and addressing complications such as hypertension and anemia. Diabetes mellitus. Diabetes mellitus is a metabolic disorder characterized by high blood sugar levels due to the body's inability to produce or use insulin effectively. It is more common in overweight and older cats. Symptoms: increased thirst and urination, weight loss despite increased appetite, lethargy, and weakness. Prevention: maintaining a healthy weight through proper diet and regular exercise can help reduce the risk of diabetes. Treatment includes insulin therapy, dietary changes, and regular monitoring of blood glucose levels. Hyperthyroidism. Hyperthyroidism is a condition caused by an overproduction of thyroid hormones, typically due to a benign tumor on the thyroid gland. It is common in older cats. Symptoms: weight loss, increased appetite, hyperactivity, vomiting, diarrhea, and increased thirst and urination. Prevention: there is no known way to prevent hyperthyroidism, but regular veterinary checkups can help detect the condition early. Treatment options include medication to manage thyroid hormone levels, radioactive iodine therapy, and surgical removal of the affected thyroid gland. Genetic and congenital disorders. Genetic and congenital disorders are conditions that cats are born with, often due to inherited genetic mutations. These disorders can affect various aspects of a cat's health and development. Hypertrophic cardiomyopathy, HCM. Hypertrophic cardiomyopathy is a genetic heart disease characterized by the thickening of the heart muscle, which can impair the heart's ability to pump blood effectively. Symptoms: some cats may show no symptoms, while others may experience difficulty breathing, lethargy, fainting, and sudden death. Prevention: there is no way to prevent HCM, but genetic testing can help identify carriers of the disease. Breeding programs should aim to reduce the prevalence of HCM in affected breeds. Treatment focuses on managing symptoms and complications, including medications to improve heart function and reduce fluid buildup. Polycystic kidney disease, PKD. Polycystic kidney disease is a genetic disorder characterized by the formation of fluid-filled cysts in the kidneys, leading to kidney dysfunction over time. It is commonly seen in Persian and related breeds. Symptoms: increased thirst and urination, weight loss, vomiting, and lethargy. Prevention: genetic testing can identify carriers of the PKD gene. Responsible breeding practices can help reduce the incidence of the disease. Treatment: there is no cure for PKD. Treatment focuses on managing symptoms and maintaining kidney function through dietary changes, hydration, and medications. Parasitic infections. Parasitic infections are caused by external and internal parasites that can affect a cat's health. Common parasites include fleas, ticks, mites, and worms. Fleas and ticks. Fleas and ticks are external parasites that can cause itching, skin irritation, and transmit diseases such as Bartonellosis and Lyme disease. Symptoms: scratching, hair loss, redness, and visible fleas or ticks on the cat's skin. Prevention: regular use of flea and tick preventatives. Maintaining a clean living environment and checking for parasites regularly can help prevent infestations. Treatment includes using flea and tick control products, grooming, and treating any secondary infections or skin issues. Intestinal parasites. Intestinal parasites, such as roundworms, hookworms, and tapeworms, are common in cats and can cause various gastrointestinal symptoms. Symptoms: diarrhea, vomiting, weight loss, bloated abdomen, and visible worms in feces. Prevention: regular deworming, maintaining good hygiene, and preventing hunting or scavenging can help reduce the risk of intestinal parasites. Treatment: deworming medications are effective in treating most intestinal parasites. A veterinarian can recommend the appropriate treatment based on the specific parasite. Respiratory and gastrointestinal diseases. Respiratory and gastrointestinal diseases can significantly impact a cat's health and quality of life. These diseases often require prompt diagnosis and treatment to prevent complications. Asthma. Feline asthma is a chronic inflammatory condition of the airways, often triggered by allergens. It can cause difficulty breathing and wheezing. Symptoms: coughing, wheezing, labored breathing, and lethargy. Prevention: reducing exposure to allergens such as cigarette smoke, dust, and certain cleaning products can help prevent asthma attacks. Treatment includes medications such as corticosteroids and bronchodilators to reduce inflammation and improve breathing. Managing environmental triggers is also important. Inflammatory bowel disease, IBD. Inflammatory bowel disease is a chronic condition characterized by inflammation of the gastrointestinal tract, leading to digestive issues. Symptoms: chronic diarrhea, vomiting, weight loss, and poor appetite. Prevention: there is no known prevention for IBD, but feeding a high-quality diet and managing stress can help reduce the risk. Treatment: treatment involves dietary changes, medications to reduce inflammation, and managing symptoms. A veterinarian may recommend a hypoallergenic or prescription diet.